Next up, we're going to be doing some fillers. So we have a lovely patient here in her late 60s who has recently lost some weight and is looking to revolumize her facial structure and get it back to kind of where she was prior, which is difficult because we are seeing a lot more people on medication or just on weight loss journeys. And if you lose weight as you get older, a lot of times it comes from the face and her face ends up looking very drawn and much older than you felt prior to. But obviously following a healthy lifestyle and weight loss journey is very important. So we're here to help those patients kind of to recover their facial structure and achieve some facial balance back to where they were prior to losing weight. So over time, naturally, as we age, we notice some things happening, right? So we have more hollowing around the orbit. So in this patient, she has what we call some malar festoons and a little bit of fat pad show here. That's because as we get older, not only does the bony structure that supports our eye widen, we also have a septum here that is sort of like a thick layer of tissue that separates some of our fat pads from the actual skin. And as we get older, that septum gets a little bit more loose, and it all is part of that process of losing collagen or not producing as much collagen. And so we're noticing a little bit of outpouching of some of these fat pads, but also this area, which is called a malar festoon, which is a really tough area to treat, but we're going to try to mask it by replenishing some of the volume she's lost in the lateral face. Another thing that happens as we get older is we lose the fat pads in our cheeks. So there's layers of fat pads, we call them, in the malar cheek, which is this area. And we sort of lose them or they shrink. And as a result, we see descent of the midface. And a lot of people notice this mainly as a nasolabial fold, they call it. So a lot of patients come in, they want us to treat the nasolabial fold. But really, the treatment needs to be back here more laterally to really lift. So you can see when I replace a little volume or kind of tug on the lateral zygoma, we efface this nasolabial fold or soften it. So whenever I do filler, I always start laterally to see what movement we can get laterally before we start filling medially. Also, she's noticed that the corners of her mouth have sort of turned down and she's developing a little bit of heaviness in this marionette or melolabial area. And so again, we'll start laterally to see what we can do to help improve this jawline to lift and tighten the skin medially. It's really targeting the areas that change as we age. As a result of those changes, we're seeing a lot of changes medially, heaviness, excess tissue, folds and lines starting to occur. But that change is really starting back here. So this is where we're going to start with our filler. So we have a plan to do a little bit of injectable calcium hydroxylapatite in the midface, and then we're going to use a hyperdilute version of that in the lower face and jawline to again lift and tighten. So now we're going to treat with neuromodulators. So these are commonly known as BOTOX, Xeomin, Dysport. Essentially, they prevent the muscle from communicating with the nerve so that the expressions that we make on our face and neck are softened. So neuromodulators, you might have heard of Botox, are also used for other indications like hyperhidrosis, which is excess sweating under the arms. We also treat the scalp for excess sweating. It can treat pain from TMJ or when you grind your teeth. It can also be used in this area or the masseter area for facial slimming. So there's a lot of indications, but today I'm going to go through the most common indications and I'll show you by just marking out the areas that we're going to treat prior to injection. So I like to make sure that the patient expresses with each injection because every individual face is so different. Although we know in general where these muscles lie, there's really no grid or no specific pattern that works for everyone. Start by treating the glabellar complex, which is the area of the face that leads to this negative emotion of frowning. And it's really an area that is, nobody wants to look like they're always angry. And so if you're going to start anywhere with neuromodulators, this is a great place to start, right in the glabellar area where these 11 lines start to form. So if we have the patient frown for me, great. So we're going to mark where the procerus muscle is. This is the muscle that kind of leads to this horizontal crease on the nasal root. And we're going to treat the corrugators right here, because these are what are contributing to those 11s. So that's going to be our pattern for the glabellar complex. Now, something I like to do as well is do a little bit of a brow lift. And so I treat right at the tail of the brow. I always palpate for where that orbicularis muscle is because it lies on the bone, and everybody's brows are different, especially if they've been microbladed. And so it's important to palpate for the orbicularis. So actually I'm going to change my marking to right about here because that was a little bit high. Then we're going to treat, she's really bothered by these crow's feet. So these are the lines that project from the corner of the eye, which are created when you're smiling or expressing. They're not necessarily negative, but some people really hate them. They feel like it makes their eyes look tired. And so if you smile for me, there you go. So we're going to treat really all along the orbicularis oculi, which is what's contributing to those crow's feet. Great. Next, we can treat what we call the DAOs. If we move to the lower face, the DAOs are what contribute to this sort of frowning muscle. So it pulls on the corner of your lip, and over time, the corner of the lip becomes more downturned, kind of like a comma. People really hate that. And so we can treat that DAO right here. So we mark lateral to that melolabial fold. Great. And so we can see where this other important muscle called the DLI is in action. We want to avoid that muscle because, as you can see, it contributes to keeping the corner of the lip up. So we're way far away from it. But in the same area, we can treat the mentalis, which what kind of crinkles up and leads to that orange peel type appearance of the chin when you make that expression. Do it again, please. So a lot of people, again, over time do not like this sort of wrinkled appearance of the chin because it can stay etched into the skin. Relax. Now on this patient, it's really not, but it's a nice area to treat if you have a little bit of toxin left. And now we're going to work on these forehead lines, and we start with what we call treating above the line of convergence, which is really this central line on the forehead. All of our injections we want to make above that so we don't cause a heavy brow. The neck, there's a muscle that holds up your neck called the platysma, which contributes to these horizontal bands on the neck. Now, we don't see many here, but we want to treat those to prevent the development of crepey skin on the neck and some banding. So now we're going to do a clear and brilliant. This is a low level, low energy, non-ablative fractionated laser. And essentially, it's a nice way to maintain your skin over time. So I have a lot of patients who come in every 4 months or so, or seasonally, and they get the Clear and Brilliant for a nice refresh. It can also be done prior to wedding, so pre-wedding prep, or if you're taking pictures of the family for the holidays, it's a great procedure to do prior to that. And I'll tell you why. So what the Clear and Brilliant does is it really delivers energy kind of superficially under the skin, but that heat helps to break apart pigment in the superficial layer of the skin and also collapse blood vessels, in addition to stimulating collagen remodeling. So really it helps with browns, reds, and overall facial texture. And the great thing about it is it's really not that painful. So patients numb for maybe half an hour prior. Some patients don't ask for numbing after they've had the first. They're used to what it feels like, and so they don't really need numbing the second time. We can also use cold air to help with discomfort, but really it is quite a comfortable procedure. And so the wavelength of this laser is 1927 nanometers. So again, the target here is water. It's heating up the water superficially under the skin to help break apart those pigmented cells or melanin and heat and collapse blood vessels, in addition to stimulating cell turnover and collagen remodeling. So after the procedure, she's going to be a little bit pink, but that will subside within an hour. So there's no real pain associated with it post-procedure. And then for the next few days, you'll get a rough sort of gritty-like texture on the skin that'll be more tactile, so something that you know has happened, but really if you're talking to a friend or a colleague, they're not going to notice anything is changed with your skin. Over the next week, like I mentioned, it'll sort of slump. Then the nice clear and brilliant skin will be revealed underneath. Like I said, most patients will come in and use this as a maintenance type procedure. So you can get a halo maybe once or twice a year, and a Clear and Brilliant more often, so every few months or so. This is a procedure that can also be combined with things that we'll do BBL or broadband light treatment prior, or we can do Clear and Brilliant and then your neuromodulator treatment after. So it's a nice way to stay on track, sort of a checkpoint in with me or your cosmetic dermatologist or board certified aesthetic provider. Another great thing about the Clear and Brilliant is that you're already numb. So a lot of my patients come in and we do their neuromodulator treatment right after. So if you're scared of needles or you have a lot going on and you'd rather stack your treatments and be the most efficient you can be, we can really do 3 procedures in one day. So like I mentioned, you can do your BBL, which will help with some of those reds and browns on the skin more superficially. And then we can do Clear and Brilliant right after you've numbed. And then we can do your neuromodulator treatment. So really, you don't have to do anything in terms of maintaining your skin for another 3 to 4 months, which is great because we're all busy and have a lot going on, multiple calendars to manage. So we just finished the Clear and Brilliant. You can see post-procedure, she's uniformly pink, but pretty comfortable. How does that feel?
Great.
Pretty comfortable. So ice packs will help. You might not even need them. If it's a cooler day, just rolling down your window on the way home, the feeling of heat will subside by the time you get home. So again, really no downtime, super comfortable procedure. Often we'll put on a tinted moisturizer with sunscreen right after, and the redness will really be camouflaged with just that. So picture Clear and Brilliant. So next we're gonna do BBL. That stands for broadband light. It's also known as IPL or intense pulse light. The device we have is the BBL, so that's what we're going to call it today. What's great about it is you can choose different wavelengths to filter out. So if we're treating brown, we'll choose a specific wavelength that targets mainly brown. If we're treating red, we'll choose another wavelength that targets red. So this device, it's actually an energy-based device, not a laser, because it covers a wide spectrum of wavelengths that treat both reds and browns on the face. Now, the important thing about this device is it's not for everyone. The ideal patient has what we call skin types 1 through 2 or 3. So a more fair skin complexion with a lot of red and brown and that typical like ruddy skin that you can think of. If you have ruddy skin or reds and browns on the skin, you're a great candidate for BBL because we can kind of clean everything up in one shot over a series of treatments. So typically we recommend about 3 to 4 sessions, maybe 2 or 3, just depending on how much you have going on in the face. And I call this really like a clearing the canvas type of treatment because we are treating more of that superficial layer of skin where there are areas of dyspigmentation, like I mentioned, reds and browns. So our patient today is fair. She has some freckling on the face, a little bit of red, a little bit of brown, very mild. This would be a nice place for her to start if she's never had any treatments done in the past. This is a really nice, no downtime procedure, no numbing required, easy in and out over lunch. And her recovery is going to be pretty easy. So some of the brown spots might get a little bit darker brown and then slough over the course of the week. And the redness really, she might be a little swollen, but that will subside by the end of the day. So let's get started. This is an energy-based device. It's not a laser. And this is a cooling plate. And we'll fire and you'll let me know if it's tolerable or if it's too hot. Should be hot but tolerable. Okay? Mm-hmm. Ready? That's up. Bye. Just finished the BBL and you can see that the brown spots have this nice sort of rim of pink around them, especially on the nose, and you can see on the left side of the face and also on the forehead. And then she's also just overall pink, and that will subside over the next few hours. But the brown will become even darker and then start to slough. And so little by little, we'll get these areas lightened and cleared up so she can be ready for the holidays. Post-procedure treatment, and in this case, we're gonna be using exosomes. They've been shown to help with post-procedure erythema or redness and reduce that recovery time, and also help with the regenerative process of tissue once it's been injured to help the patient recover. So this was a very minor injury. We just did some BBL to keep both the reds and browns on the canvas or the surface texture of the skin. So we'll use exosomes to help reduce that post-treatment erythema, which you see. But we can also use them post-halo, post-clear and brilliant, post a lot of the procedures we saw today. So I've drawn up the exosomes into a 10 ml vial, and they're suspended in saline. And so we're just going to gently apply and massage. Feels better already. we're here in the PDL room again, and we are going to treat a scar. So this device I use often for scars. In today's case, this is a melanoma scar, but we use PDL to treat all kinds of scars, specifically if they're still pink post-surgery or trauma. So I've treated post-thyroidectomy scars, post-abdominoplasty scars, breast reduction, breast augmentation scars. So the whole gamut of scars can be treated with the PDL, specifically if they're red. So this patient has a scar on the arm. This was from a melanoma surgery about 2 years ago, and it's been treated so far with some microneedling, so it's become a lot flatter, but she's still bothered by the appearance. There's a little bit of brown and a little bit of red still in there. So what I like to do is kind of blanch the scar to see if I push on it, does the redness dissipate? And in a way it does. I can still see the brown, but the red is gone. So perhaps if we removed some more of the red, it would be less visible. So we're going to do that using the PDL. Again, this is our pulsed dye laser. It's a 595 nanometer wavelength. It targets hemoglobin in blood vessels and causes them to collapse. So we're hoping that the blood vessels under the scar will collapse with subsequent treatments, and over the course of a few months, it'll get much better. It's important to find the glasses that filter out the wavelength that you're using the laser for. And we're going to set up our PDL. So this laser kind of feels like a hot rubber band snap followed by a cold spray of air. And the cold spray is a cryogen cooling mechanism that helps to protect the skin from the heat of the laser. So you'll hear that as we go along. So we're gonna get started, okay? Here we go, 1, 2, 3. How's that?
That easy.
Great. Great, and I like to do a little bit on the top border and a little bit on the bottom. Great. And so we'll give her some ice packs post-treatment and have her come back in about a month for a second treatment.